Good day everyone, I am Karlya Asperela, a student nurse from Medical Colleges of Northern Philippines. Today, I will be demonstrating the assessment of neurologic, musculoskeletal, and the peripheral vascular system. So to begin the assessment, we must first identify the patient and explain the purpose and procedure of the assessment. Of course, answer any questions of the patient. Also instruct the patient to void if possible and collect the urine specimen if ordered. Good morning, ma'am. I am Karlya Asperela and I will be your nurse for today. May I know your name and birthday, ma'am, for verification, ma'am?
Angel Asperela, January 15.
Thank you, ma'am. So, ma'am, I'll be assessing your neurologic, musculoskeletal, and peripheral vascular systems. I will be touching some parts of your body, and there are these movements that you should follow. And is that okay with you, ma'am? And do you have any question, ma'am?
Yeah.
Thank you, ma'am. After identifying the patient and explaining the procedure of the assessment, perform hand hygiene and assist the patient into a sitting position. So the patient is seated already. So begin the assessment with a survey of the overall patient hygiene and physical appearance. Good morning, ma'am. So how often do you brush your teeth, ma'am?
3 times a day.
Thank you, ma'am. How about did you take a bath, ma'am?
Opo.
Thank you, ma'am. After the survey, I can say that the patient's hygiene is good and as well as her physical appearance. So, the next assessment is to assess for the patient's mental status. Ma'am, can you state what the date today, ma'am?
August 14, 2021 po.
How about the time, ma'am?
5 o'clock.
And do you know where are you, ma'am?
Bato Rizal po yan po.
Thank you, ma'am. So, ma'am, can you close your eyes? Can you close and open your eyes, ma'am? Can you pinch your nose, ma'am? And, okay. So, the patient GCS is 15 because she was able to do things perfectly. And next is, ma'am, can you explain to me the word saying early bird catches the worm?
Industrious po.
Thank you, ma'am. And lastly is the patient is able to do things as instructed to her, and so her mental status is stable. So let us proceed to the next, and it is to test the cranial nerve function of the patient. So ma'am, may I ask you to close your eyes, then occlude one of your nostrils, and then identify the smell of this, ma'am?
Alcohol po.
Sa kabila po, ma'am.
Polvo po.
Thank you, ma'am. So, let us also check for visual acuity and papillary constriction. So, ma'am, I want you to follow the direction of this pen, ma'am. So, okay. Can you smile for me, ma'am? How about wrinkle your forehead, ma'am? How about puff your cheeks, ma'am? Okay. So, let us also test for your hearing, ma'am. I will whisper a word and you tell me what you have heard. Okay, ma'am? Could you occlude your one ear, ma'am? Happy birthday.
Happy birthday.
How about sa kabila?
Merry Christmas.
So, okay? Good. And ma'am, can you shrug against my resistance and push your cheek on the right against my resistance and repeat to the left, ma'am? Can you shrug, ma'am?
Ganito.
How about push your cheek on the right, ma'am? Ganito. Kabila po. So, as you have seen, the patient has done all the maneuvers without difficulties. Visual acuity, pupillary constriction, as well as gag reflex is good and is able to identify odor and words being whispered easily. So, let us proceed to the inspecting the patient's ability to move his neck. So, ma'am, can you touch your chin to your chest, ma'am? How about to your shoulders, ma'am? Dito po, ma'am. Then, tip your head back, ma'am. Okay. So, the patient is able to do what is being instructed without any difficulties. So, let us also inspect and palpate your upper extremities. So, there are no lesions, rashes, and muscle mass present. The temperature and texture are also normal as per palpation, and there is no palpated mass. So, next is, ma'am, can you please extend your arms forward and rapidly turn your palms up and down, ma'am? Like this, ma'am. Up po, ma'am. Down po. How about, please flex your arm and resist my force, okay? Baba po. Okay, now we will inspect and palpate your hand, fingers, wrist, and elbow joint. Okay, there are no mass or lesions being palpated, and the appearance of the upper extremity of the patient is also normal. So next is to palpate the radial and the brachial pulse. So, both radial and brachial pulses are normal. So, next is, ma'am, can you please squeeze your fingers, ma'am? Okay, so the patient is able to do so. Can you please close your eyes, ma'am, and identify the number that I will be writing on your palm, ma'am?
Eight po.
Sa kabila po.
9.
Thank you, ma'am. So the patient was able to identify what numbers are written in her palm. So next is, can you close your eyes again, ma'am, and identify the object that I'll be putting in your palm, ma'am? Ano po to, ma'am?
Alcohol po.
Sa kabila po, ma'am. How about this one?
Pencil po.
Thank you, ma'am. Okay, so the patient was able to identify the numbers written on her palm and the objects that was put on her palm without any difficulties. So next is to position the patient into a supine position. So let us examine her lower extremities, inspect the legs and feet for color, varicosities, hair growth, nail growth, edema, and muscle mass. So as per inspection, there are no presence of varicosities, lesions, as well as muscle mass. So let us also test for the pitting edema in the pretibial area. Okay, there is no pitting edema as per testing. So next is to palpate for pulses and skin temperature at the posterior tibial, dorsalis pedis, and popliteal area. So the posterior tibial, the dorsalis pedis, and the popliteal pulses are all normal, and the skin temperature also are normal. So next is to have the patient perform the straight leg test with one leg at a time. So ma'am, the patient can do it without any difficulties. So let us proceed to the next. Ma'am, can you move your leg with knee straight laterally, ma'am, and back to the medial, ma'am? No, hindi po. Taas niyo po, ma'am, pag ano. Tapos, sa kabila po. Thank you, ma'am. So as you can see, the patient can do the adduction and abduction without any difficulty. So let us move on to the next. Ma'am, can you raise your thigh, ma'am, against my resistance, ma'am? Ang kabila po. Okay, ma'am. Oh, and then push your thigh outward with my resistance and then backward, ma'am. Ganito po. Push nyo po ng pataas. Yung isa po, ma'am. How about downward, ma'am? Pababa po. Yung sa kabila po. Okay, so the patient has done the rising, moving outward and downward of the thighs against resistance without any difficulty. Okay, so let us proceed to the next, which is the assess patient's deep tendon reflexes using a reflex hammer. So there's no available reflex hammer here, so I'll be using this improvised hammer. Let's assess the left wrist, then the other. Next is the over antecubital area. So next is over triceps tendon. So next is the lower extremities below the patella. Next is over the Achilles tendon. So the patient has breast respite in all area being assessed and it is normal. Also stroke a hand object on the sole of the patient's foot. Can you feel it, ma'am?
Opo.
Sa kabila po, ma'am. Can you feel it, ma'am?
Opo.
So, the patient can feel it as you have seen. So, next is, ma'am, can you dorsiflex and plantar reflex your both feet against my resistance, ma'am? How about this one? Yung kabila po. Thank you, ma'am. So the patient can dorsiflex and plantar reflex her both feet without any difficulties. So after that, assist the patient into a standing position and ask her to walk and then observe. Ma'am, can you please walk? Ma'am? How about walk with your toes, ma'am? How about with your heels, ma'am? So as you have seen, the patient walks with her regular gait with her toes, heels, and with both without any difficulty. And lastly is let the patient perform Romberg test. So ma'am, please remain standing and put your feet together. Then close both of your eyes at your arms and side po, ma'am. Ito po kayo. Pagandito po kayo. Can you close your eyes, ma'am? Yan. Close your feet, ma'am. So, remain this position within at least 20 seconds. So, as the patient is performing the test, observe the patient's swaying and ability to maintain balance. And you must be alert to prevent the injury if ever the patient loses balance. Tama. Tama na po. So, as you can see, the patient was able to perform the test without any difficulty. So, after the assessment, of course, help the patient to position of comfort. Po na po kayo. And then perform hand hygiene. And then do not forget to document the findings of the assessment. So that's it for the demonstration. Thank you.